Welcome to Read an Article site, learn, search, and get updated. From the Clinical, Implant, Dentistry, and Related Research journal, we chose this article for you. Clinical and Radiological Characteristics of Oro-antral Communications and Fistula due to Implant Dentistry Procedures, a cross-sectional retrospective study. Objectives: to assess the unique clinical and radiological sequelae following oro-antral communications fistula due to implant dentistry compared with other etiologies. Conclusions: clinical and radiological sequelae due to oro-antral communication and fistula secondary to implant dentistry procedures are more severe compared to other etiologies. The suggested pathogenesis is a foreign body reaction. Early and accurate diagnosis of the foreign body location followed by its early removal is recommended. Oro-antral communication definition: it is defined as unnatural opening communication between the oral cavity and the maxillary sinus. When the communication becomes epithelialized, it is defined as oro-antral fistula. The causes of oro-antral communications: it happens during posterior maxillary tooth extraction, surgical removal of cysts, inoculation of pathological lesion, following zygomatico-maxillary complex fracture, maxillary sinus surgery for treating severe infection or neoplasm, periodontal disease, implant placement, and bone graft procedures in the last few decades. They have unique clinical and radiological sequelae compared to other etiologies. Signs and symptoms: if it's acute, epistaxis, fluid or air passage through oro-antral communication or fistula, pain, voice alteration. Signs and symptoms: if it's chronic, it acts as a pathway for further bacterial and fungal penetration, leading to sinusitis in 60% of cases. The symptoms are pain, free escape of fluids, antral polyps, postnasal drip, dysgeusia, voice alterations, earache, mucopurulent nasal discharge. Treatment of sinusitis secondary to oro-antral communications fistula: cleaning and debridement of the sinus, closure of the oro-antral communication fistula. The cleaning of the sinus can be achieved either through the fistula or via surgical approach such as the Caldwell-Lock approach, used as well as foreign body removal and oro-antral fistula closure, or functional endoscopic sinus surgery, transoral or transnasal approach, which is used mostly in treating implant dentistry etiology group. The closure of oro-antral communication and fistula can be achieved by mobilizing local or distant flaps, grafts, and other techniques. The most commonly used local flaps include the buccal advancement, palatal rotation, buccal fat pad flaps, and combination of them. Study notes: no significant differences were found regarding gender distribution, smoking, diabetes, and ACA status. Presence of a foreign body in the sinus was found in significantly higher rates in the implant dentistry etiology group compared to other etiology group, which causes chronic maxillary sinusitis, sinusitis. The natural drainage through the ostium is blocked. Most of the implant dentistry etiology cases demonstrate a full maxillary sinus opacity. The oro-antral communication cannot close naturally. Bone graft cause more problems than implant problems only. Remaining root removal cause problem more than impression materials and surgical trials. No problems associated with episectomy in upper dentition, even it's close to the maxillary sinus. Periodontal disease may result in sinusitis. Cysts rarely lead to sinusitis unless infected. Only when the ostium is obstructed, preventing the natural drainage, maxillary sinusitis will develop. Radiological symptoms. In the implant dentistry etiology groups, the imaging of the maxillary sinus presented an obstructed maxillary sinus full with secretions and mucosa in most of the cases. Fewer cases presented aerated sinus with thickened mucosa. In other etiology groups, more than half the cases presented a non-irritated sinus. Less than the half of the cases presented with an irritated sinus with a thickened mucosa. The incidence of chronic sinusitis as diagnosed from available imaging was found to be higher in the implant dentistry etiology group. If the patient has gone through previous functional endoscopic sinus surgery prior to the treatment of the oro-antral fistula or communication, presented with significantly higher rates of virulent discharge and higher rate of fluid passage through the oro-antral fistula or communication, and more likely to complain on facial pain prior to surgical intervention. Operative and post-operative characteristics. There is no significant difference between the two groups regarding the success of the closure, operating time, length of the hospital stay, type of flap used for the closure of the oro-antral communication or fistula, post-operative request for analgesics, and the post-operative radiographic appearance of the sinus. Implant placement itself can also produce sinusitis, although such a situation is rare. There is no complications when implant penetrated 2 to 4 mm in the sinus at 10 years follow-up. Although even there is complications, they are few as epistaxis and thickening of Schneiderian membrane. Foreign body reaction as amalgam remains from episectomy in the maxillary sinus worsens the prognosis, so it is desirable to remove such foreign bodies.